So let's take a look at some treatment of the calf. We're looking at the lower leg. We're going to go from the knee down to the ankle. However, there are some muscles that cross the ankle and some that cross the knee. So we are going to extend a little bit further up at certain times. The first one that we're going to look at is gastrocnemius. So gastrocnemius is the most superficial. It's the big one that we can see from the back. And we're going to mention all these muscles layer by layer because we need to get through the superficial ones to get to the deeper ones. So gastrocnemius does cross the knee, which means that my massage strokes with effleurage that I'm doing right now are going to cross the knee as well. And I'm aiming to visualize the origins of gastrocnemius, which would be at the medial posterior femoral condyle and the lateral posterior femoral condyle. So just above the knee, back of the femur. And it's going to come down to the Achilles tendon into the calcaneus as well. So we just need to make sure that we're covering as much square inchage of that muscle as we possibly can. And we're starting quite superficial with effleurage, which means going with the fiber direction. Because we're going superficial, we can go a bit quicker. It's only as we start to go deeper that we really need to go slower. So while we're still focusing on the most superficial layer, let's continue to warm things up, which is a large part of what we're doing here with some petrissage. Petrissage is just transverse strokes. So I'm picking up, putting down, and making sure I retrieve that tissue with the other hand. So we're kneading. We're trying to go all the way around from the medial tibia around to the lateral fibula. So as we start to get through those layers, we're now thinking about what's underneath gastrocnemius, and we've got Soleus. The difference between Soleus and gastrocnemius is Soleus stops below the knee, so to target this muscle we don't need to worry so much about going above the knee. So now let's start to reinforce some of these effleurage strokes, because we're having to get through gastrocnemius, but hopefully now we've warmed it up to the extent that we can get to Soleus a little bit easier. And you'll notice that I'm going medial to lateral. Every stroke is slightly more lateral, just to make sure that I'm covering as much muscle as I can, but also not to overwork certain areas of muscle fiber. And you'll feel there the difference between the lateral head of the gastroc, the medial head of the gastroc, and where the Achilles and particularly Soleus start to almost terminate on the lateral side. So now we're going even deeper. Probably exhausted what I can do comfortably with my thumbs. We need to look to other body parts to get the depth that we need. So we're going to go to knuckles now. With knuckles, I like to use the cam and spindle technique, which is to put that part of your knuckles and fingers down onto the skin. We're going to keep the fingers trailing and relaxed. Try and keep these joints in good alignment all the way up the chain, wrist, elbow, shoulder. Pop the left hand in and lean the body weight over the top. So you say if that's getting too much for you, okay?
Okay.
And I'm going nice and slow now. So now we start to think about that deep compartment of the lower leg. You can see the erythema there, the space in between the knuckles where the fingers were. So just give them a break. Some faster, more superficial effleurage before we come back in again with a slightly different approach, now more medial, making sure these fingers that are touching the skin are relaxed. And we're starting to think now about the muscles of that deep compartment. We've got extensor hallucis longus, extensor digitorum longus, and we've also got tibialis posterior, which is the deepest one. Difficult to palpate, you won't be able to feel it through palpation. You've got a lot of soft tissue to get to before that point, but it is in there. Just around the side we've got the perineals as well. They're very superficial, they're quite sinewy, quite tendinous, and we get up to the head of the fibula and the common perineal nerve is there, so just beware that can be quite painful to palpate. More depth perhaps required so we can alter the position of the client's leg. So we're going to pop our leg underneath, one swift movement like that. Some practice may be required. We've just got their ankle relaxed into your hip crease. This keeps the ankle in plantar flexion, which shortens the gastrocnemius, making it easier to access the muscles deeper to it. Also flexes the knee, shortens the gastrocnemius from the proximal end. So now we've got a shortened muscle in the gastrocnemius from the distal and proximal end, which means we should be able to get even deeper into these tissues, meaning that we don't have to push quite as hard as we were before. So now we bring out the elbow. When I say elbow, I don't mean the pointy bit, I mean that shaft of the ulna, the flat bit right before the end. We're going to keep everything nice and relaxed and lean gently in We don't need to push hard here at all. Less is more, especially to start off with, and you can gauge the reaction from the patient before going any deeper. I'm trying to vary those strokes. We've had one central, one lateral, and now this last one's medial. And let's give them a break. So we can come back in with some light effleurage. We can go with the knuckles again if we want to, and then back in with some elbows. So in this position, we might also want to give a bit of a stretch to those tissues just to make our touch here more effective. So we can do that by just changing the alignment of our body to face straight on, and we've now got control of the ankle to move into dorsiflexion. So that gives us the stretch. We combine that with some compressive force down, and all of a sudden we've got an STR, soft tissue release. Using the knuckles at the moment, you can see that combination of passive ankle dorsiflexion, which gives a nice stretch as it is, but then the knuckles on top. So this is actually focusing on Soleus, because gastrocnemius, as I said, is shortened from the proximal end. So Soleus will be feeling the bulk of this stretch. For more of a gastrocnemius focused stretch, we need to make sure the knee was in extension. Bit of petrissage in this position as well.
That was really good, by the way.
The petrissage?
Yeah, and working into the Soleus as well.
With the stretch?
Yeah.
Good.
Yeah, particularly that one.
Good. Pay attention to that client feedback, because it does need to feel nice. And then the last thing we can do, again, we're thinking about shortening that gastrocnemius. To fully shorten, you bring it up into that knee flex position 90 degrees, and also ankle in plantar flexion. And while we're there, we can just sit our body in, bring that leg in close to the body, which is going to keep it secure and stop them from tensing up to protect, but also it's going to keep that ankle in plantar flexion. And from there we can play the cello, which is straightforward petrissage, but we're using flat fingers in across the calf, and then the elbow needs to be coming behind you, not out to the sides. And then we can alternate, push together with the palms, pull apart with the fingers. That's a petrissage technique. Getting as deep as we can into the calf because of the removal of gastrocnemius by the positioning of the leg. And just make sure that you're all the way around to the medial side, just short of the tibia. We can pick up some soleus. We can even pick up a bit of tibialis posterior there as we get more distal. And the same around the lateral side, we can put that focus on the perineals there. If you need to control the leg, you can always just hold the calcaneus with one hand and then use the other to apply the strokes. Other muscles to be mentioned in the area, we've got plantaris. You're not really going to palpate plantaris. Big long tendon, tiny little muscle belly somewhere up here behind the knee, and also popliteus. But there is a bit of massage and anatomy for the lower leg or calf.